Some alarming statistics this morning. The number of Australian cases of COVID-19, it's now sitting above 2,000, surpassing predictions.
Yeah, it's numbers like these that have prompted our leading medical experts to call for a dramatic escalation of the country's lockdown. Sydney neurologist Dr Kate Armand and clinical immunologist Dr Dan Swan join us now. Good morning to you both. Thank you for your time this morning. Dr Armand, to you first of all, I understand this rapid increase in the number of cases in Australia has you really worried. Please explain why.
Well, I think first we know that nobody's immune to this condition, so there's no immunity in the community, so everyone is susceptible. Then from the experiences in other countries, you know that about 15 to 20% of people get really sick with it and require hospitalisation. And some of those people will then require ventilation in ICU. And the problem is that we're getting an exponential rise in cases. So it's likely that over the coming weeks that the cases will go up significantly, and the big worry is that we'll run out of hospital or ICU beds and potentially ventilators. So some of the people that get very sick need ventilation in order to survive the illness, and it's come to the point in other countries where those ventilators just haven't been available, and I think that is absolutely terrifying. It's not just old people. Yep.
No, sorry, continue.
It's not just the very elderly that are getting very sick. It's actually young and middle-aged people too. We know that in Sydney that there are people in their 40s and 50s on ventilators. We know that very young people have died overseas. So this is, I think, scary for everybody.
Because I think what we're hearing here in Australia, we're hearing the number of Australians who have contracted coronavirus, but we're not getting an understanding of how many of them are then having to be hospitalised, and of those who are hospitalised, how many are going into ICU. Do either of you have any idea?
I think my understanding is that, firstly, the statistics are not very reliable at the moment because many people were hospitalised at the start of the outbreak for quarantine reasons, so not necessarily with a medical need. But speaking to my colleagues, it appears that Australia is following what has happened in other countries, with about 15 to 20% needing hospitalisation, probably about a third of those, up to a third, needing ICU, and about half the people in ICU needing ventilation. So they're big numbers when you look at a large proportion of the community potentially getting infected.
Dr Swan, we have to be careful here in a way, because the last thing we need is conflicting medical advice. And I think that only confuses us who don't understand it completely all the more. Brendan Murphy, over the last couple of weeks, has been at pains to point out that a short-term shutdown of our society will not work. All the while, they come out and they gradually increase the restrictions on us and the lockdown to a point where I guess they could have done it weeks ago. Who is right? And you say we should go into more strict lockdowns. What does that look like?
The message that I've been getting out to people is that the government has to make decisions based on lots of priorities, and that's really difficult, and everyone needs to understand that. Our appeal has been to every individual Australian to understand what the problem is and then take personal responsibility to stay home and to stay away from the viral transmission process. I understand why people sense that there's a conflict in the messaging. I get that. But I think the most important thing is that every Australian understands what the problem is. We have a rapidly spreading and contagious virus passing from person to person in the community. And the way we stop that is to come into our homes and stay there.
I mean, what we're hearing from the hospitals, that a lot of them, they're running out of gloves, masks, and as we know, we are nowhere near the peak of this. Dr Swan, how do you see this playing out over the coming weeks? What do we look like, say, in a month's time?
The hospitals are preparing as best as they can. Every hospital is doing their best to prepare for the wave of patients that we know is coming. The thing that hospitals really need is time, and that's where the community can really, really help us. If you stay at home, if you stay out of the transmission process, if you don't get this virus and you don't pass this virus on, then what that does is to slow and delay the wave of patients arriving in our hospital system, and that buys the hospital system really precious time. Time to organise, time to get more resources, time to get things from overseas that we need in terms of personal protective equipment. So that's the reason that it's so important to get this message out to everybody. Please stay home.
Okay, and again, the conflict here is I think, really difficult because I think some of us go, and me included, let's lock it all down. I have a job. I'm lucky enough to have a job that is continuing. I can afford to have my children at home schooling. We can do all of those things, but there are people out there who can't. So managing the economy as well as managing this health crisis is a difficult balance. I get it, but is Brendan Murphy putting at risk an escalation, Dr. Ahmed, in this health crisis by delaying the lockdown?
Look, I think that the government and Brendan Murphy have done a great job so far. It's a really difficult situation because you are balancing the health risk with the economic risk, but not just economic risk, but the livelihoods of people. I mean, so many people have lost their jobs. It's absolutely devastating. But I think that this virus is something like we've never seen before. And we are potentially looking at hundreds of thousands of excess deaths. So at this point, the health crisis needs to be prioritised, and I would advocate for a full lockdown, similar to what the UK is doing now.
See, I agree with that. I agree with what you're saying. And then we have conflicting advice from Brendan Murphy saying we don't need that at this point. The shutdown of society will not work. I don't know. I mean, for us at home, it leads to confusion. You're medical experts, and you're saying that, and there seems to be a division.
I think the problem is that this is an unprecedented situation, so there is always going to be a conflicting views. And there are experts saying both things. So some are saying we don't need a full lockdown and some are saying we do need a lockdown. But I think as individuals, we can definitely minimise our chance of contracting the condition and passing it on by staying at home.
OK, good on you. Thank you so much for your time.